When we looked through the global patient survey that we do every 2 years, we had a subset of patients that have had CAR-T. There were 83 patients overall. And then we took another subset down and looked at patients specifically who had diffuse large B-cell lymphoma. We compared that group with a matched set of patients that also had diffuse large B-cell lymphoma, would have qualified for CAR-T, but did not get that treatment. And what we were looking at specifically was the psychosocial impact of the disease and the support that they received. What was really interesting in this study is we did know that patients that had had CAR-T received more support than that matched population. They also were more likely to have their psychosocial concerns followed up than the matched population. Now, I will say in neither case was support ideal. Patients were followed up, I think, in 32% of the cases of those who had CAR-T and 14% in the matched population. A third of patients getting follow-up is not great, but it is better than what the other group is receiving. But I do think it indicates there's room for improvement in both groups. We surmise that really the difference in the care being provided is due to the fact that oftentimes CAR-T patients are treated with a multidisciplinary team, and others don't have the benefit of that kind of support when they're going through treatment. We also know through our qualitative interviewing with CAR-T patients that they specifically said they had far more support than they did at any other part of their patient experience to date. And on average, those patients had had at least 4 prior therapies. So it does show that there is some difference, definitely, with patients receiving CAR-T. At the same point in time, there was a small portion of those patients that would have been treated in a clinical trial. And again, we know patients that are treated in clinical trial also receive increased levels of support. But need to make it better overall for everybody.